Right now at 5:30, we are just on the start of flu season. National health experts are predicting it will be one of the worst we've seen in a while. Today, the Ohio Department of Health released new flu cases for the state. Right now, Central Ohio has the most, with 12 cases reported in the first week of October. ODH will update this information weekly. Now, because it could be a year without a high amount of cases, we're talking live with Dr. Joseph Gastaldo from Ohio Health. And Dr. G, we want to thank you for joining us today.
Yolanda, thanks for having me. It's great to see you.
You too. First, let's start with that warning. Why do experts believe it will be a busy year of flu cases?
Yeah, three big reasons. First of all, coming out of COVID, where we are now, people aren't wearing masks anymore. COVID is still going on. We're still averaging close to 400 deaths a day from this virus. And previously, the past 2 years, we have really avoided flu because we were all wearing masks. We were more isolated. Second thing is
true.
in the southern hemisphere, specifically Australia and New Zealand, they were hit hard with their flu season that they just ended. And that's always the canary in the coal mine for us having a really bad flu season. And thirdly, since we didn't really have flu season severely the last 2 years, a lot of people have not been exposed to this virus and really don't have any immunity to this. So there are more vulnerable individuals.
Oh, wow. Okay. Well, new numbers from the CDC show that there have been 10 to 15 million fewer people in the U.S. getting their flu shots compared with the past 3 years. Why do you think that there's that hesitation to get the flu vaccine?
Yeah, it's multifactorial. Unfortunately, in the setting of COVID, I think it really did a disservice to the trust in public health. First of all, we had to recognize the flu shot that we use has been around for a long time. And I think with all of the confusion with COVID and COVID fatigue, a lot of people are less willing to get a flu shot. Nonetheless, the best form of protection that you have to protect yourself from bad outcome is the flu shot. It's FDA approved and CDC recommended for everybody 6 months and older.
Is it ever too early to get that flu vaccine?
Potentially, yes. Traditionally, flu season does not peak until late December, early January, all the way through February. So theoretically, if you do get it too early, like early August, your antibody titers might peak outside of the peak flu season. So traditionally, I'm usually telling my patients to get their flu shot by Halloween.
Okay, by Halloween, so you got a couple weeks left. Well, this is on COVID-19. Let's go to that real quick. With most of our counties being in green, meaning a low spread of the virus, should we be worried going into the winter months about another outbreak?
Absolutely. The virus is not going away. And like other respiratory viruses, when people are indoors more so, they're gathering, we have the holidays, the ventilation of the air is not the best. That's fodder for more spread of COVID-19 and other respiratory viruys.
I think you're all right. People have COVID fatigue. We've done all the vaccines for that and the boosters, so they're really just not thinking about flu. I think that's just, a sidebar, but it is time to start thinking about that.
It is time to think about that. And really, we have the tools today really to protect those more vulnerable. And for that matter, everybody against flu and COVID-19. We have vaccines, we have outpatient treatments that are available to at-risk people.
All right. Dr. Joe Gastaldo with Ohio Health, thank you so much for joining us.
Thank you, Yolanda.